5 facts. When we talk about cardiovascular disease, as you know, we talk about the heart and we talk about the brain. Second, this is actually the mortality, you know well, across the world. And cardiovascular disease is the number 1, but you have to really integrate myocardial infarction and stroke. And here is the high income countries, and you can put United States. United States is taking a position of trying to contribute to less developed countries. The question is what we are doing for the United States. Number 3, this is a problem. You read that mortality is decreasing related to cardiovascular disease. This is absolutely wrong. This is age adjusted. Life has been prolonged 6 years in 3 decades. And 60% is related to treatment. But if you go beyond these 6 years, mortality is significantly increasing. It's really an epidemic. And actually, you know this very well, but I want to just point out that the price that we pay by prolonging life thus far has been mainly due to interventions, which are extremely expensive. Let me make a comment about this line and a comment about this line. So why mortality is increasing? This is just to take diabetes in the United States. It's a real epidemic. You can do it in percentage of the population, you can do it in numbers of people in the population. But this is very staggering. This is just Western Europe, Canada, and Australia. This is United States. This is like what is the average lifespan in these countries, and in the ordinate is the how much is invested on health by the GDP. And here is a complete paradox. We are spending a lot of money in technology, and we are not making any really success in actually going up in terms of life. So there is a real problem. By the way, I have 2 passports, Spain and United States. So you cannot take my criticism of anything because I feel absolutely working with both countries. The United States gave me an opportunity which I will always value. This is where we are. We always complain, I had a cardiac event, how it happened. Well, the disease takes many years to develop, and now the whole focus is, can we act here before the event takes place? And this is my final comment in terms of the facts. We look at the risk factor profile today, and certainly we have at least 7, which this is 2 mechanical, obesity and blood pressure, and here you can put dietary surveillance. You have 2 chemicals, diabetes and cholesterol elevation, 2 questions, smoking or not, sedentary life or not. And if you look at all of these, you realize that this is related to behavior. And I'm not going to talk about today, but we already have good data. The control of these, there is a lot of a behavioral situation. Are people taking the medications? So do we have a problem? We are dealing with a disease of behavior. And if we don't get away from, if we get away from this and we start talking about genetics and not paying attention to what is happening, I think we're absolutely out of line. That's the question I want to make. So now I'm going into, this was general comments. Now I have been working with the Institute of Medicine at the National Academy of Science with NHLBI, and I'd like to present to you a few comments of the document that we recently developed. This is an interesting committee. In fact, our committee was charged to how can we promote health worldwide. But the question is why the committee has 8 economists. So probably something has to do with economy, otherwise you wouldn't have so many people in that aspect. Having said that, this is actually what was published just a year ago, but I'd just like to make 4 comments in terms of the findings. First, we are in a society which is at high risk for behavior, misbehavior. Why? Because it's a world of consumption, and this is extremely hard to be a saint. Second, governments have not been particularly interested in chronic diseases. It takes too long to have an event. And in fact, we have too many pressures. to take care of early and acutely. That's the reality. It's not a criticism. It's the reality of life. Third, lack of communication within the different sectors of government. Is the Minister of Health communicating with agriculture, the food industry, education, transportation? And number four, the tremendous heterogeneity that exists in the same country, from country to country, or even in the same city in terms of health delivery. That's really the four aspects that were identified. From a generic point of view, each of these aspects is beginning to be approached. For example, now we are beginning to talk about behavior, health. How healthy is the population I'm dealing with? In blue is everything I said to you about the risk factors, but it means you're taking care of all of them. Obesity, absence of smoking, good exercise. And in red are the biological factors I mentioned. Blood pressure, diabetes, and cholesterol, which is a point of behavior, as I pointed out. And the question is, how good we are in terms of behavior? Well, this is just on these three studies, United States, okay, you can say if you're perfect, you're here. And if you're biologically you're perfect, you're here. So this means what is the number of events in a 10-year follow-up if you're perfect on the 7 items I gave to you? 1%. How many people in the United States are perfect? Less than 1%. So it's easy to talk about, but we have a problem. And the problem is an issue. It's a problem of behavior which we try to ignore. And really it's very, very difficult to be at this stage. And this is just recently published. Having said that, this is the first point about how difficult it is to have a good life and to be a saint from the point of view of health. The second issue is governments, as I mentioned, do not have real policy for chronic diseases. I'm talking generically, and particularly United States. Look all the guidelines that are coming out. Are these guidelines really having an impact? I'll leave this up to you. But there's one every year. Can we sometime pull ourselves together and do something together? I'm just presenting to you the reality of what has been going on over the last few years. I think there is a drive for that. And actually, number three, intersectorial communication. I can have this in the discussion, but these are all the organizations, many of them are represented here. Is each organization dealing with the other organizations? Is WHO dealing with the World Bank? Just an example. Or with the CDC? And these are what we should accomplish. I hope somehow, somewhat, if the World Bank has the money, and the WHO has the advocacy, can they work together? What I'm saying to you is we have to integrate what are the strengths of the organization to have an impact in the world we live today. At least there is a thinking process on that, and this is in the document that I presented to you. And finally, there was a meeting recently about the heterogeneity of healthcare in different countries, in different regions, even in the same city. And this is a document that actually came up last week, also from the Institute of Medicine. In this regard, I think that what is going on from the Institute of Medicine and the National Heart, Lung and Blood Institute and other alliances in the world is, can we go out and at least begin to develop centers of excellence across the world, particularly in developing countries? At least this is a driving force on the four aspects I presented to you before about the heterogeneity. And certainly there are now centers of excellence that are being developed to capacity building, training and education, and actually research. And there are actually 10 collaborating centers in the world today. I can go into the details, and this is really sponsored by the National Heart, Lung and Blood Institute and by other alliances in Canada and in the United Kingdom and in Australia. This is just trying to go to the countries. The most important message I want to give to you today, if we don't go down to earth, we will always talk conceptually. And that's what I want to do in the last few minutes. After all my experiences with all these committees, I just came out with the following. There were 12 recommendations from the IOM. There are two that to me are critical. One is called research, and the other is called children. And I want just to focus for a moment on that.